Hi, this is Jenny Dozier, and today I'll be sharing with you my service line presentation for a new service line for our IDN called Connect Care Integrated Health. The proposal I'll be sharing here today has to do with this new service line, which will be integrated into the whole IDN network. And this particular proposal is going to be based more primarily off of being sure that we're able to add more behavioral health services with this new service line. The location of this new service line is going to be serving the Hampton Roads general area. And a little bit about getting to know what Connect Care Integrated Health Services is going to be bringing to our IDN. And that is going to be that we certainly provide already a network of providers, high quality coordinated care to our patients. We are representing a range of hospital locations, ambulatory services, hospices, imaging centers, clinics, and urgent cares already. So what is going to set us apart? What is this service line going to provide where there is a need? Right now, we know that our mission is to offer more specialized and integrated frameworks to address the mental health concerns and issues, behavioral needs of our Hampton Roads population. This is more of a comprehensive goal, excuse me, and it is reflecting the development of a range of services from assessments to counseling, interventions, and also addiction and substance abuse treatment. Now, the reason for this, the reason for addressing these community needs specifically in mental health, comes down to research which shows us that there are tremendous disparities that still exist when it comes to general populations being able to access quality mental health care and preventative services. And so we know that in the United States alone, we have a significant proportion of adults who are not receiving any form of treatment. If we look to the literature, we can see based on national surveys that continue to show us that the majority of individuals are not receiving the mental care services that they need. And so this estimate projected going forward as we enter into the need to see more specialized services for mental health care and prevention, and the significant shortages in staffing for mental health care facilities across the country, we know that there is certainly a great need in the area to fill those particular community services for our population, for our patients. Understanding why individuals may not be receiving the mental health care, behavioral services that they need, that they require, comes down to a lot of different things. Sometimes it comes down to patients who believe that their treatment is not needed, that how they're feeling, what they're going through is a sense of normal, not understanding that there is help and services that can mitigate those symptoms. The overwhelming cost of healthcare in general and mental health services, or those that may not be covered by various insurance plans, the lack of services in an individual patient's area, and also not even knowing where to go. Where can I access these services? What is available to me based off of my insurance plan, based off of affordability, and what is available in my general area? We know that there is a significant stigma associated with receiving mental health care, and that stigma and those opinions can certainly impact whether or not an individual seeks assistance and services. There also may be uncertainty about where to get treatment, what types of treatments are available, and concerns about how their data, their particular personal health histories and mental health histories may be kept confidential and secure in these facilities. So a little bit more about our service line overview here, how as a vertically integrated IDN, we're already providing care to patients at all stages of life. And that is that vertical integration where we are going to keep them in network as best we can from cradle to grave. Everything from end of life care services to physician networks, peds, ortho, surgeons, OBGYNs, and of course behavioral health services. So our comprehensive service line overview, to continue with this, with our general mission is to be sure that we are streamlining patient care services. That is what we want to do. We want to make sure that this is a seamless approach and holistic healthcare experience for our patients. We want to foster a patient-centric model. So we want our patient to be the center here. We want to make sure that this is a structured and comprehensive journey for our patients, from diagnosis through treatment and rehab if necessary. We offer a variety of deliver services and a variety of particular treatments for our patients. And of course, we want to integrate more and include more behavioral health services here with Connect Care. So with Connect Care, we hope to make sure that we are including both inpatient and outpatient settings and facilities. We want to offer intensive care for individuals who are undergoing crisis, counseling, therapy, biomedical management of those particular symptomologies, and continuous support for those who are already receiving treatment. And we can work to achieve this particular service line and integrate this into our community, into our IDN. And one of our main missions is to make sure that by using Connect Care within the IDN, by adding the service line, we're also going to make sure that we're emphasizing the need for developing community outreach. So educational programs, preventative programs to address our population's broader healthcare needs regarding mental health. And to emphasize this again, we want that patient-centered approach. That is our mission. That's our goal. That's foundational to what Connect Care is. It's about collaboration. It's about multidisciplinary approaches. It's about breaking down those stigmas associated with mental health services and care, and making sure that we are reaching individuals in their communities where they are at all stages of life. When it comes to estimating the staffing that will be needed, to compare, what we try to do is go ahead and compare the size and reach of our IDN with other similar networks out there. So we're trying to, copy off other people's homework. What have other folks already done? What does the staffing look like at similar facilities across the country? And so in looking at various IDNs across the country and their need, their staffing needs, and their staff populations, and trying to estimate the proportion of that would be dedicated to something like Connect Care's behavioral services model, we decided that 3,000 full-time employees, 800 part-time employees, with that FTE calculation of 23,800 employees was the number that we arrived with. To estimate equipment and services, we know that the reach of this is going to depend on the size and of these facilities and institutions, and also the size of the population being served. And so based off of our estimates and looking to the literature, we are estimating that equipment and services would be around $3.5 million projected cost. This is a screen capture of our balance sheet for this year, where we are already. And the next few slides are some projected income statement estimates based off of total revenue, and a projected positive net income expected based off of salaries and benefits, which we expect to be a good 60% of our overall operating expenses, the supplies, the facility maintenance, depreciation of buildings and facilities, professional fee, cost, leases. When it comes to the organizational structure, we are modeling this off of a traditional structure of vertical integrated health. So starting at the top with our corporate leadership, we will have our board, our CEO, president and executive team, clinical services division with our chief medical officer, down to our primary care and specialty care divisions, hospital division with our chief hospital administrator, finance and administrator division with our chief financial officer, and then supporting administrative staff. And this is just a very rough representation of what that organizational chart will look like when it's all said and done. I have a few reference slides here, but I want to thank you for your time and attention, and I appreciate your review of this proposal. Thank you so much.